Good evening, everybody. I happen to have a very late day today. One of my patients, he had a status epilepticus, and I had a call at 9:30 to attend, and it got very late. So now almost it is early morning, 12:45. After returning, somehow I felt today I did not do much for you all guys. So I thought, why not spend some time before I go to sleep? Some of our nocturnal classmates will always be awake preparing for the exam. So today is September 18th. We have another 100 more days before the NEETPG exam. So, wow, we have Harsh, Chamoli, Devabrata, Roshan, and many more who are still awake. Very good. So, शुरू करेंगे जरा antibiotics के बारे में जरा पढ़ाई करके then we will go to sleep. Deal? That's good. Now, Doctor. Yes. Yes. Good to see Deva, Bhrata, Ray, Manjunath and everybody. Very good. Our evening night club is very much resilient and ready for facing the exam. Excellent. Now, doctor, antibiotics, you should know how to summarize it very crisply. So that is what we are going to do. Yes. Yeah. Hope I am visible. Very good. So there are certain polymorphisms of the drug, doctor. So we should be very sure. G6PD deficiency, primaquine and sulfonamides, they lead to acute hemolytic anemia. Isoniazid, those who are slow acetylators, typically they develop peripheral neuropathy. Similarly, hydralazine, slow acetylation, that lead to lupus syndrome. Succinylcholine, when there is a slow ester hydrolysis, that lead to development of prolonged apnea in the people. You know, succinylcholine you have created muscle relaxation. And at the end of the muscle relaxation, when you are expecting the patient after the surgery to recover from that muscle relaxing, suppose if there is a slow ester type of a genetic polymorphism that lead to prolonged apnea. Tolbutamide, those who slowly oxidize develop cardiotoxicity. Ethanol, those who are slow acetaldehyde oxidizers, they will develop facial flushing, is what you need to remember. Doctor, this is one illustration definitely going to come in the exam. You have to be very much sure about. If you happen to plot the time against plasma concentration, if you happen to plot plasma concentration against time, it will be a descending straight line like this if it were to be zero order kinetics. Whereas if it is a hyperbola like this, then that is a first order kinetics. इसको देख के आप रिकॉग्नाइज करना पड़ता है कल के एग्जाम में. नाउ फटाफट बोलो डॉक्टर, एक बट्टी मारने वाला मैटर. What are 30S ribosomal subunits? 30S and 50S. You have to be 100% sure in the tomorrow's exam. So let's get well with that concept. Yes. So doctor, you should remember that if you take what are 30S and what are 50S, let us look into it. 30S, 50S. You have to mercilessly remember them, there is no other way. See, if this is 30, then this will be 50. There are the two important subunits which are there in the ribosome. I hope you are having the focus. Focus, focus, focus. 1 minute. I am trying to get the focus. Yes. Right. Aminoglycosides, doctor. Aminoglycosides. They are 30S. Tetracyclines. What will you remember? 30S. What are tetracyclines? Demiclocycline, doxycycline, minocycline, tetracycline. Yes, sir? 30S. What are aminoglycosides? Amikacin, gentamicin, kanamycin, neomycin, streptomycin, tobramycin. All aminoglycosides are 30S. That is what you need to remember. Then macrolides, doctor, macrolides. Please don't forget. Macrolides, azithromycin, clarithromycin, erythromycin. They're all 50S. 50S. You should not forget. Then you have other antibiotics. Chloramphenicol, clindamycin, linezolid, quinipristine and dalfopristin and telithromycin and mupirocin. They are all considered to be 50S. 50S. So ये लिस्ट तो बहुत लंबा है. Better you remember aminoglycosides, tetracyclines, everything as 30S. And other than these two, aminoglycoside and tetracyclines, everything else think of 50S. That becomes the correct answer, is what you need to remember. So, doctor, now you know what are the antibiotics, which is 30S, which is 50S. Examiner is serious about this matter. Okay, now, whenever you use aminoglycosides, you need to do a dose adjustment to reduce the nephrotoxicity, is what you need to remember. Fatafat, bullet maro about antibiotics. Antibiotics revision within 15 to 20 minutes, then you are a champion, doctor. Why you want to give aminoglycosides as a OD, not BD, OD, single daily dosing? Because they have a long post-antibiotic effect and they do a concentration dependent killing. These are the 2 points that you need to basically remember. If you look at aminoglycosides, they're all taken up by the bacteria by a oxygen dependent process. Agar aminoglycoside need to enter into bacteria, it is an oxygen dependent process. आपका एनारोब्स जो होता है वो ऑक्सीजन को परवाह नहीं करता है. That is the reason aminoglycosides are not effective against the anaerobes, is what you have to basically remember. Aminoglycosides are the bactericidal inhibitors. Are they cidal or static? Cidal or static? यही बात क्वेश्चन एग्जामिनर पूछेगा. So you should be very sure. Then aminoglycosides and tetracyclines, what do? 30S ribosome को inhibit करेगा. Do you use aminoglycosides for gram negative or gram positive? Gram negative infections. And always remember, जब भी स्यूडोमोनास आर्यूजिनोसा होता है, वहाँ एंटी स्यूडोमोनल पेनिसिलिन के साथ aminoglycosides दिया जाएगा. So that is what you need to remember. Now, we use streptomycin in what all the scenarios? Tularemia. This is a favorite MCQ of examiner. Plague में which is the antibiotic you will give बोल के examiner पूछेगा कल. प्लेग में स्ट्रेप्टोमाइसिन देते हैं. दिस वन एलिमिनेशन क्वेश्चन होता है. Those who did not prepare for the entrance seriously, they missed this answer. Plague में streptomycin. Plague में streptomycin. So, doctor, out of 300 MCQs, those who have seriously prepared and picked up, they will invariably answer 270. आराम से आप आंसर कर सकते. Only thing is, you have to be conscious, focused, and you should be in a position to catch what the examiner is going to ask you. भैया, tuberculosis में streptococcal endocarditis, enterococcal endocarditis, mycobacterial infections, we use the streptomycin. Now, doctor, I am going to ask you a very, very interesting question. Tetracyclines have the broadest spectrum of action of all the antibacterial protein synthesis inhibitors. Broadest spectrum होता है tetracycline को. Broadest spectrum होता है tetracycline को. It is not aminoglycoside. It is not macrolide. It is not fluoroquinolone. What should be your answer? Tetracycline, Jindabad. Tetracycline has the broadest spectrum. Tetracyclines, they bind to divalent and trivalent cations. That is what you need to remember. Tetracyclines, they concentrate in tissues which are very high in calcium or in DNA. Please don't forget. Tetracyclines, for example, teeth, right? Tetracyclines are teratogenic because if you happen to give, they lead to development of the staining of the teeth of the embryo. So that is the reason tetracyclines concentrate high in calcium or DNA. Tetracyclines, what do they do, doctor? Aminoglycosides, tetracyclines. You are not going to forget 30S ribosome. So what are tetracyclines? Tetracyclines are bacteriostatic, is what you should remember. Abhi batao, garma garam MCQ in the tomorrow's exam. Vareva, 30 online students, हम बहुत खुश हैं. इतना early morning, I thought, how many of you will be still longing with that imperishable dream of becoming a topper? I'm so proud of you all guys. You guys are all my inspiration and you are all my life, right? So now, tetracyclines are the antibiotic choice in which condition? Chlamydial, brucellosis, mycoplasma pneumoniae, rickettsial, and some spirochetes, Lyme disease, and also as an alternative for syphilis. So please don't forget this fact, doctor. ये डेफिनेटली पूछने वाला क्वेश्चन है. मैं खाली गारंटी वाला क्वेश्चंस के बारे में गारंटी का बात कर रहा हूं, ठीक है? तो इसलिए हम व्हाइट बोर्ड के पास जाएंगे और कलम लेंगे, साथियों के साथ बैठेंगे और एक बार लिखे तो याद रहेगा. टेट्रासाइक्लिन्स, where will you use? This is going to be the examiner's question, right? So chlamydia, tetracycline. Brucellosis, tetracycline. Mycoplasma, tetracycline. Rickettsiae, tetracycline. And Lyme disease, tetracycline. And as an alternative to syphilis. Alternative to syphilis is what you have to basically remember. Now, doctor, let us focus on some more important bullets. A tetracyclines जो होता है, they are the category D in pregnancy and contraindicated in children younger than 8 years of age is what you have to remember. Now, what are macrolides, doctor? What are the 3 antibiotics? Azithromycin, clarithromycin, erythromycin. ये तीनों को कहते हैं macrolides is what you need to remember. Now, typically macrolides are static, but for some bacteria, they are cidal. They are cidal is what you need to remember. Macrolides are all 50 years. मैं इसके पहले ही आपको बताया. Aminoglycosides, tetracyclines are 30 years. Everything else पूरा दुनिया में जो भी है 50 years मारो. ठीक है? Now, how are they eliminated, doctor? They are eliminated by biliary secretion. That's an important point about macrolides. Then another important thing. Will azithromycin inhibit cytochrome P450? No, sir. It does not inhibit. That is the speciality. If you don't want cytochrome P450 to be touched at all, then a good choice is azithromycin is what you need to basically remember. Azithromycin has to be administered only for 3 to 5 days only for most of the infections. And all macrolides, what do? They go and bind with 50S ribosome is what you have to remember. एरिथ्रोमाइसिन जनरली क्या होता है कि जब भी पेनिसिलिन से एलर्जी होता है, इन लोगों को एरिथ्रोमाइसिन का इस्तेमाल कर सकते, वो है इसका स्पेशलिटी. एंड मैक्रोलाइड्स आर वेरी गुड फॉर द रेस्पिरेटरी इन्फेक्शंस इज व्हाट यू नीड टू रिमेंबर. Always few things like we use fluoroquinolones. Very special about them is we use it for urinary tract infection. इसलिए उसको याद करना. Similarly, we give macrolides for respiratory infection. Then another important thing is chlamydial infection along with gonorrhea है. Most of the times we assume a double infection, both the chlamydial and also gonorrhea. So, what is the drug of choice? Please don't forget. Single dose azithromycin is the drug of choice for the treatment of chlamydia concomitant with gonorrhea. Chlamydia concomitant with gonorrhea. Now, erythromycin, what does it do? It inhibits cytochrome P450. It causes a lot of dirty drug-to-drug reactions. Erythromycin and clarithromycin, both of them similarly inhibit P450, मगर azithromycin जो होता है ये बहुत अच्छा बच्चा होता है. एजिथ्रोमाइसिन इनहिबिट नहीं करेगा. एरिथ्रोमाइसिन और क्लेरिथ्रोमाइसिन P450 को इनहिबिट करेगा. This is one point examiner is going to check you in the forthcoming NEETPG exam. Erythromycin causes the most frequent GI adverse effects, but comparatively clarithromycin and azithromycin produce less number of GI side effects. It's quite a common experience, those who take erythromycin having a lot of GI complaints. Now, chloramphenicol, what does it do, doctor? 50S ribosome से bind होगा. मैं इसके पहले ही आपको बताया, aminoglycosides और tetracyclines, only two classes of drugs that you need to remember when it comes to 30S inhibition. सारे सब कुछ दवाइयाँ 50S inhibitors होता है. That is what you need to remember. Chloramphenicol, it is active against gram-positive and also negative anaerobes. Anaerobes के ऊपर अगर आप युद्ध करना है तो chloramphenicol is good. Chloramphenicol से दो चीजें याद रखना. Lethal aplastic anemia. किसको aplastic anemia होगा नहीं बोल सकते आप, because it is idiosyncratic and also dose related. Both the ways aplastic anemia can happen. Gray baby syndrome in the case of the newborns with chloramphenicol, please don't forget. Chloramphenicol is a strong inhibitor of microsomal oxidation. इसलिए phenytoin, tolbutamide and warfarin, all these three things, typically their blood levels become increased is what you need to remember. So, this late, we are all had a fortune of meeting up and having a quick chat. So that patient for whom I became held up till very late in the night with status epilepticus, that boy was taking the lamotrigine and he recently had thyroid dysfunction, and he became non-compliant with the therapy. A lot of times epileptic patients are non-compliant. That makes them go into status. Always when managing status, you should always check whether the patient was regularly taking the medicines or not. So the patient, the boy was stabilized, pulled out of the status. So after returning home, I thought, भैया एक बार बैठ के हमारे पूरे साथियों नीट पीजी साथियों के साथ जरा पढ़ाई करेंगे, ठीक है? So let us discuss few more points before we go to sleep, doctor. So clindamycin, it is effective against anaerobes. Now, linezolid is used to treat vancomycin resistant organisms. Please remember, linezolid से एक very important drug interaction के बारे में examiner कल exam में पूछेगा डॉक्टर. Linezolid inhibits MAVO. Linezolid antibiotics, it inhibits MAVO. This is one most frequently asked MCQ about linezolid in addition to its usage in vancomycin resistant organisms. Then quinoprestin, dalfopristin, they are also used to treat vancomycin resistant organisms. And quinoprestin, dalfopristin, it is also a strong inhibitor of CYP34A is what you have to remember. Very good. Abhijit Vakhande rightly says linezolid inhibits MAVO is a point that need to be remembered. Now, doctor, what are sulfonamides? Silver sulfadiazine, sulfacetamide, sulfadiazine, sulfasoxazole, and what are dihydrofolate reductase inhibitors? Trimethoprim, sulfamethoxazole. So you should be very sure what is working where. TABA becomes dihydrofolic acid, and that enzyme is called dihydroteroate synthase. That is the one which is inhibited by sulfonamides. Then dihydrofolate becomes tetrahydrofolate by the action of the dihydrofolate reductase. It is the trimethoprim responsible. Tetrahydrofolate is used by purines. That become DNA is what you need to remember. अच्छा भैया एक गर्मा गर्म फटाफट रिव्यू हो जाए on some of the most important antibiotics. Mainly you should know where are they specially used and what is their side effect and what is their mechanism. Simple hai. Pharmacology is very simple provided you know what to read, what to remember, what to mug and what to reason it out. Now doctor, cefdroxil, cefazolin, cephalexin. In that droxil and lexil, both of them are used orally. They are called first generation. Bhaiya, a first generation, second generation, third generation, fourth generation, examiner cephalosporins are the favorite area for the examiner. Now all cephalosporins, how do they work, doctor? They inhibit transpeptidase cross-linking and they are more broader spectrum than that of the penicillin G. So where do you use first generation? Cellulitis, staphylococcus and streptococcus cellulitis. And also they are used for surgical prophylaxis, especially cefazolin is used for surgical prophylaxis. All cephalosporins, doctor, you should worry about what? They can lead to seizures. They can add to nephrotoxicity. They can lead to urticaria, rash, pruritus, and pseudomembranous colitis. You should always remember. Now, second generation, doctor, where do we use second generation? And what are second generation? That is important. Color. Kya color hai bhaiya? Safa color. Then, cefotitan, cefoxitin, cefoprosil, cefuroxim, and loracarbef. These are the second generation. They are used for PID. Gynecologist का second generation इस्तेमाल होता है. Diverticulitis, gynecologists and obstetricians marry surgeons. Diverticulitis में. Abdominal surgical prophylaxis, cefoxitin is used. Please remember. See, always first generation, second generation, they are very active against gram positive. So wherever you are anticipating gram positive, they are very, very effective. Okay? Now, pneumonia, we use second generation. H influenza, bronchitis, alcoholic people, etc., etc. H influenza होता है ना डॉक्टर? There also we use second generation is what you need to remember. Excellent. Kunjit Joshi rightly says, burns dressing में we use sulfadiazine. Badhiya, badhiya. Now, third generation, what are they? Cefdinib, ceftitorin, cefixime, cefpodoxim, and cefibutyn. They're all oral. Whereas cefoperazone, cefotaxime, ceftazidime, ceftriaxone, ceftriaxone, they're not oral. So we use it in Neisseria, meningitis, community acquired pneumonia, cap infections में third generation cephalosporins डॉक्टर. ये बात नहीं भूलना भैया, जब भी न्यूमोनिया होता है एल्डरली पीपल में, एल्डरली पीपल क्यों मर जाते डॉक्टर? Why elderly people die in our acute medical care unit? Always remember, women elderly means urinary tract infection. It's a very common thing. Diabetes leading to urethral stenosis in a elderly woman, and that lead to development of recurrent UTI. So UTI हो या pneumonia हो, वो दोनों यमधर्मराज का स्पेशल CBI एजेंट्स है, pneumonia and UTI. You have to bomb them like anything so that they don't kill the old man, is what you need to remember. For the osteomyelitis, ceftazidime, gonorrhea, ceftriaxone and cefixime, and Pseudomonas aeruginosa के लिए क्या यूज करते? Which is the cephalosporin, which is anti-pseudomonal. Ceftazidime is the one which is basically used. Kunjit Joshi is asking, sir, antibiotic prophylaxis is 1 hour before or half an hour before skin incision? ये तो जरा देखना ही पड़ेगा, right? So somebody please check that. What is the most recent guideline about it? 1 hour के पहले या half an hour के पहले? जरा एक बार देख के बताओ. So, but it's a good question. Now, doctor, fourth generation होता है Cefepime. Where do you use it? Neutropenic fever में parenterally you use Cefepime. That's what you need to remember. Now, Estrionam, where do you use, doctor? For all gram-negative rods, Serratia, Klebsiella, Pseudomonas, we use the Estrionam is what you need to basically remember. Now, doctor, there are certain important Carbapenems that you need to know. पहला नाम बताओ. Doripenem, Atrapenem, Imipenem, Silastin, and Meropenem. Now, where do we use them, doctor? When there is a mixed aerobic, anaerobic, and Pseudomonas aeruginosa, which is resistant to other drugs. But Atrapenem is not that effective. Then febrile neutropenic patients, often with aminoglycosides, we use it, these carbapenems for the enterobacter infections is what you have to basically remember. Kunjit is saying, anesthesia book में बोलते हैं half an hour, सर्जरी बुक में बोलते हैं 1 hour. अरे बाप, इसलिए इतना बुक्स नहीं पढ़ना बेटा. 1 minute, I'm just putting a little bit of AC. Yes, doctor. Yeah, sorry, I went. अच्छा, रोशन बोलता है कि गौतम सर बोला कि he said not exact time but given before incision. That is the easiest answer, right? Very good. Now, doctor, fosfomycin. Yes, fosfomycin. What does it do? It inhibits the synthesis of the peptidoglycan monomers. And where do we use it then, doctor? UTI in the women who are susceptible to the strains of E. coli and Enterococcus fecalis, you use fosfomycin orally, is what you have to basically remember. Now, doctor, how does vancomycin work? Vancomycin inhibits transglycosylation. Please remember, transglycosylation. भैया vancomycin releases histamine. उसके वजह से आपको रेड मैन सिंड्रोम हो जाएगा. All that intense flushing. Vancomycin is also known for ototoxicity and nephrotoxicity, similar to aminoglycosides. So where do you use vancomycin? Staph aureus, methicillin-resistant Staph aureus, Enterococci, and other gram-positive bacteria in penicillin-allergic patients. Now, doctor, what are 30S inhibitors? Aminoglycosides. What are aminoglycosides? Amikacin, gentamicin, kanamycin, neomycin, streptomycin, tobramycin. And where are they used, doctor? Proteus, Klebsiella, Serratia, Enterobacter, Pseudomonas is what you need to remember. And aminoglycosides can lead to acute tubular necrosis and also neuromuscular blockade. That is the reason we need to basically remember. Now, Kunjit Josh is asking, sir, will notes be posted for this video? And also, Pappu is asking, sir, आपका वीडियो चाइना से भी देख सकते हैं. अरे बाप, ऐसा इतना दूर है क्या? अच्छा, तो चाइना से भी देख रहे तो जरा फोटो में भी दिखाएंगे. सायोनारा बोलना. अच्छा, सायोनारा इज जापान, राइट? Good. I'm so happy that from China also you are able to watch. Good, doctor. Next time I'll get well ready and come for the class. Good. So, yeah. So, you should remember, doctor, that see, the whole idea is all these things are available, doctor. All these things are available in the textbook. इसमें कुछ भी अजीब बात कुछ भी नहीं है इसमें. Only thing is you should get that motivation to read, remember, reproduce, recall. That is where I am trying to be of a great use to you. Already we have all this content in the PowerPoints. Around 2 lakh slides are available in our video library. Every video is accompanied by a PowerPoint and you have a 24/7 access to all that content, right? Right. Now, what are the tetracyclines? Demiclocycline, doxycycline, minocycline, tetracycline, and they are the inhibitors of 30S ribosome. And where are they specifically used, Dr. Tetracyclines? This is the favorite question of the examiner. Mycoplasma, chlamydia, Vibrio cholera, Rocky Mountain spotted fever, rickettsial infections, Lyme disease में doxycycline इस्तेमाल करते हैं. Similarly, SIADH, you should remember demiclocycline. Syphilis and gonorrhea, you use it as an alternative treatment. In the plague, we use doxy, and you also use as an alternative to mefloquine for the malaria prophylaxis. Doxycycline इस्तेमाल करते हैं. And similarly, the inflammatory lesions that you see in acne rosacea, वहाँ भी tetracycline का इस्तेमाल होता है, right? Very good. Samsung says even China. मोबाइल फोन में भी देख सकते भैया, यूट्यूब जहां तक ले जाएगा वहां तक हम भी आएंगे. हाँ, सो that is very important, doctor. So please don't forget these indications. Suddenly examiner वीडियो कलरा बोले तो कार्डा इक्विना लेवल में आप विदाउट एनी सोच विचार फटाफट आंसर कर देना टेट्रासाइक्लिन बोल के. ठीक है, बढ़िया. नाउ देयर कैन बी कैंडिडा सुपर इन्फेक्शन if you are using tetracycline. Photosensitivity can occur with tetracycline. Please don't forget. Now, doctor, 50S. All macrolides are 50S inhibitors. Erythromycin, clarithromycin, erythromycin. Now the examiner's question. Erythromycin कहाँ इस्तेमाल होता है? Legionnaires disease, mycoplasma pneumonia, especially mycoplasma don't have a cell wall. So that is the place where macrolides need to be used. That is, erythromycin need to be used. Genital and ocular infections, chlamydia infections, azithromycin, where do we use? Mycobacterium, avium, intracellular. Prophylaxis in advanced HIV, what do you use? Azithromycin. What do you use? Azithromycin. Please don't forget. Similarly, Haemophilus influenza and Moraxella catarrhalis में sinusitis and otitis media जो होता है, what will you use? Azithromycin. Chlamydial infections, azithromycin. Where do you use clarithromycin? H. pylori में. H. pylori में. Now, doctor, you should remember, erythromycin and clarithromycin, they inhibit drug metabolism. They lead to hepatotoxicity, cholestatic hepatitis, especially erythromycin, estolate lead to the development of cholestatic jaundice is what you need to remember, and pseudomonas, pseudomembranous colitis is another important complication with the macrolides. Now, doctor, clindamycin, how does it act? Once more, 50S ribosome को inhibit करके. और एक बार बोल रहा हूँ भैया, aminoglycosides and tetracyclines. Aminoglycosides, tetracyclines. Only they are the inhibitors of 30S is what you have to emphatically remember. So clindamycin, we use it in aspiration pneumonia, bacterial vaginosis, osteomyelitis, pelvic inflammatory disease, bacteroides, and topically in case of severe acne. You should basically remember clindamycin is the one which is used. Clindamycin also lead to pseudomembranous colitis. अभी sulfonamides आ गया. Where do you use sulfasoxazole, doctor? UTI, otitis media, chlamydia, nocardiasis. Chlamydia, nocardiasis, don't forget. Sulfadiazine for the UTI, nocardiosis, toxoplasmosis, malaria maybe, sulfadiazine. Then sulfacetamide, where do we use? For the conjunctivitis के लिए हम sulfacetamide का इस्तेमाल करते हैं. Recently यारों, Saturday, Sunday को हम एक गर्मा गर्म डिस्कशन किए. One day, one subject on the weekend morning 10 a.m. to 6 p.m. So next week हम anesthesia और dermatology खत्म करेंगे. आप सब लोग आना, भूलना मत, right? Now, मुझे कोई भी बंधु नहीं है, मुझे कोई भी साथी नहीं है, आप लोग ही मेरी दुनिया हैं. इसलिए आप भूलना नहीं कि Saturday, Sunday, I will wait for you to spend time along with you to do a garma-garam revision of anesthesia and dermatology. Now, doctor, acne vulgaris also, we use sulfacetamide. And abhi one of our classmates said, silver sulfadiazine. Silver sulfadiazine. Where do you use, doctor, silver sulfadiazine? We typically use it in the burns dressings. Kunjit Joshi Jindabad. So Kunjit said that we use it in infection of second and third degree burns. Bhaiya, sulfonamides इस्तेमाल कर रहे तो, what are the blood dyscrasias is a very, very important um, question, doctor. A granulocytosis, a plastic anemia, don't forget, crystalluria and hematuria, you should think of sulfonamides. Barabar? Now, Steven-Johnson syndrome, very severe form of Steven-Johnson. I can never forget. At least a dozen of Steven-Johnsons I have seen with various drugs, but sulfonamides predominantly. Now, what are the relative contraindications for the sulfonamides, doctor? Megaloblastic anemia. Please don't forget. Blood dyscrasias. Any pre-existing bone marrow depression. Relative contraindication. What are absolute contraindications for the sulfonamides? Alright, we should never forget porphyria, G6PD deficiency, and folate deficiency के वजह से होने वाला megaloblastic anemia relative है, but as such megaloblastic anemia is put in absolute contraindications is what you have to remember. Similarly, neonatal period sulfonamide hypersensitivity is also an absolute contraindication which you are not going to forget. Now, trimethoprim, how does it act, doctor? Dihydrofolate reductase को inhibit करेगा. Where do you use it? Prostatitis, vaginitis, otitis media, bronchitis, trimethoprim. Now, having had said that, there are certain severe complicated infections where trimethoprim sulfamethoxazole has a very important role, doctor. If you have documented pneumocystis carinii pneumonia, it is the cotrimoxazole. Typhoid fever, nocardia, you should not forget trimethoprim sulfamethoxazole. Suspected shigellosis, don't forget trimethoprim sulfamethoxazole is what you need to remember. Now, what are DNA gyrase inhibitors? You are not going to forget all floxacins, ciprofloxacin, getifloxacin, gimmick, and levofloxacin, everything. Now, doctor, there are certain very special things about the floxacins. What is that? Anthrax prophylaxis, ciprofloxacin is given. Neutropenic fever, ciprofloxacin. Similarly, you need to remember that Neisseria, Enterobacter, gram-negative rods also, we give the DNA gyrase inhibitors. Then very important is, if you are using the DNA gyrase inhibitors, avoid calcium-containing medications. Avoid theophylline. And fluoroquinolones can interfere with the collagen synthesis and it can lead to tendon rupture. Please don't forget about DNA gyrase inhibitors. Now, doctor, I am going to take you to a most important question आने वाले हैं future के exam में. Whenever you are attending these video extempore sessions, no, एक pen paper भी आपके साथ रखना. भैया, एक 30s होता है, एक 50s होता है, बराबर? 30s, 50s. Then A साइट और P साइट, दो साइट्स होता है. A साइट के पास एक tRNA जो है ना, डॉक्टर, this tRNA brings the amino acid and makes it to attach to the A site. Then A site से वो P site को ट्रांसफर होता है. P site को जाने के बाद वो पेप्टाइड में इनकॉर्पोरेट हो जाता है. So this is the typical sequence. अभी बताओ, favorite MCQ of the examiner. Tetracyclines क्या करेगा? How do they interfere? Tetracyclines and aminoglycosides. They affect the 30s. You will remember it, na? They are the ones which affect the 30s. So, जब tRNA amino acid को लाएगा, ये tetracyclines वो amino acid ये साइट को attach होने से मना करता है. So, that is the function of tetracyclines. Then how does aminoglycosides and spectinomycin basically function? Typically, they will also affect the 30S, and by affecting that, they will lead to insertion of a incorrect amino acid. NEET PG एग्जाम में ऑप्शन ए के बजाय बी लगा रहे हैं आप, क्यों? आप अमाइनो ग्लाइकोसाइड के जैसे सोच विचार चल रहा है, इसके वजह से समझ में आ गया ना? अमाइनो ग्लाइकोसाइड्स विल लीड टू incorrect amino acid to get inserted by affecting 30S. Tetracycline prevent the tRNA from making amino acid bind with the A site is what you need to remember. Then next, doctor, how do macrolides, chloramphenicol and dalfopristin, how do they work? Basically, this peptidyl transferase will enable that incoming amino acid to get incorporated into the peptide chain. That step is being prevented by macrolide, chloramphenicol, dalfopristin. All of them are binding to 50S. Badhiya. Then finally, doctor, how is macrolide and clindamycin are acting? So basically, there is a translocation step which will enable the movement to happen from the A site to P site. So that is being prevented by macrolide and clindamycin is what you need to remember. Shanti, Shanti, Shanti. Now you understood what is the story? Now doctor, where do you use sulfonamides? Fatafat bolo UTIs. Why you want to force fluids with sulfonate therapy? Because you want to prevent crystalluria. Sulfacetamide is the one which is used for eye infections because it has a neutral pH, so it will not be irritating in nature. Silver sulfadiazine, हमारे कुंजित जोशी को हम भूलेंगे नहीं. उसने हमको पहले बार पढ़ाया कि बर्न्स पेशेंट में सिल्वर सल्फाडियाजीन का इस्तेमाल होता है. Sulfonamides cause a very severe Steven Johnson. Sulfonamides will displace bilirubin from the albumin and lead to kernicterus in newborn. G6PD deficiency है तो don't use sulfonamides. And a lot of drugs are avoided in sulfa allergy. What are they? Sulfonamide antimicrobials, sulfonyl urea among oral hypoglycemics, and all thiazides. Thio होता है sulfa, इसलिए sulfonamide एलर्जी में thiazide को avoid करते हैं. Similarly, loop diuretics except ethacranic acid is avoided if there is a sulfa allergy, and celecoxib is also avoided in sulfa allergy. These are the drugs which you should not forget, contraindicated whenever there is any sulfa allergy. Now, why trimethoprim sulfamethoxazole are being taken? Because of similar pharmacokinetics. They lead to sequential steps in folate utilization get inhibited, and they have similar pharmacokinetics. For prophylaxis of pneumocystis carinii, what do you use, doctor? Trimethoprim sulfamethoxazole. Ciprofloxacin and ufloxacin, they are very good for the gram-negative organisms. Levofloxacin, gatifloxacin, they are good for gram-positive organisms. Gemifloxacin and moxifloxacin, they are good for anaerobes and pneumococci. And if you overuse the fluoroquinolones, what will it lead to, doctor? It lead to increased resistance. We have to be very careful about fluoroquinolones overuse. Fluoroquinolones दो जगह बहुत यूजफुल है. एक जगह यूटीआई है, दूसरी जगह रेस्पिरेटरी इन्फेक्शन है. Then, whenever there is an anthrax bioterrorism, रात बहुत अंधेरी है, bioterrorism, डर लग रहा है. Ciprofloxacin is the one which is being used. Please don't forget. Trivalent cations, they decrease the bioavailability of fluoroquinolones. Ciprofloxacin से एक special feature, don't forget, it causes the spontaneous rupture of Achilles tendon. वारे वाह, ये question exam में आए तो only you guys are going to answer. Nobody knows it, because even at early morning 1:36 a.m. we are all studying together. Now, doctor, trovafloxacin, its use is limited to life and limb-threatening infections. That is what you need to remember. Fluoroquinolones, you are worried. Why? Because they can prolong the QT interval. Finally, doctor, one small commercial. Please don't forget to subscribe to www.onlinemmbbs.com video library. यहाँ आपको 600 hours video lectures, 2 lakh PowerPoint slides notes, 30,000 MCQs discussed, 953 high-yield topic discussion, and NEETPG full-scale grant test and discussion every week. Every day new video lectures, midnight masala added, and live online broadcast session. So why wait? Enjoy a full panorama of the focused knowledge, what is exactly needed by the examiner and expected by the examiner for you to do the revision. So take a 3-month subscription for the next 3 months. So until the NEETPG exam. So I wish you all a wonderful good night, and it is all about the willpower. Sometimes we used to do grand rounds starting at early in the morning 7 o'clock till evening 6 o'clock, that too on a post night duty. But while doing those grand rounds, we used to feel very stretched. I did my MD General Medicine under a professor called Professor Shantaram, who is the father of great cricketer Lakshman. And Professor Shantaram is one of the god in medicine, general medicine. Very affectionate teacher. Haath pakad ke, mid-diastolic rumble ko, he will make you feel, right? So, whenever we used to do grand rounds and got so much tired, I used to feel, oh my God. But he used to say, at the end of the grand rounds, chai ke baad chai, chai ke baad chai, while you are doing completely drowsing, still you are doing the rounds and then finishing the ward work. But that increases your stamina. That increases your unsurmountable goodwill, doctor. All the winning in NEETPG is all about nothing to do with the brain. It is to do with the adrenaline, adrenal gland. So I'm so happy you are all. Who are you? Dr. Murli Bharadwaj, Super 2000 NEETPG future toppers for the NEETPG 2020. Good luck, God bless you, and then once more wake up in the morning with added energy, go back to the reading room, and then get ready for the tomorrow's exam. Good night.